Hello, my dear. I am Dr. Fernanda López, a board certified urologist with more than 15 years of experience helping men like you regain their strength, confidence, and intimate performance naturally. And today we're going to talk about something many men suffer with in silence, something that fills them with frustration and shame, but that actually has a real solution. If you can get an erection, but it fades quickly, if it only lasts a few minutes instead of as long as you'd like, if you feel the firmness slipping away exactly when you need it most, I want you to know something very important. This is not a lack of desire, and it definitely does not mean you're impotent. I see it every single day in my office. Men whose desire is completely intact, men who want to be with their partner, who feel attraction, who have all the desire in the world, but who are incredibly frustrated because they simply can't maintain the erection long enough. And do you know what they tell me with their voices cracking? Doctor, I want to. I desire my wife, but my body won't cooperate. It gets up, but it falls right back down. And I feel so ashamed. My dear, I want you to understand something fundamental. Do not label yourself as impotent. That word is harsh, final, and it does not describe what's really happening. The issue you have is functional, and functional means it can be improved. It can be reversed. It is not an age issue. It is not just how aging works. It's a problem of signals inside your body. Signals that are getting crossed, systems that are no longer working together the way they should. And when you understand what's really going on and know exactly what to adjust, everything can change. But first, we have to talk about something almost no one mentions. Something that is quietly making everything worse without you even realizing it. I'm talking about the silent shame, the emotional weight, the fear of failure. A few months ago, a 60-year-old gentleman named Mr. Arturo came to my office. A good, hard-working man married for 35 years. What he confessed broke my heart. He said, Doctor, for the last 6 months, I've been avoiding any intimate situation with my wife because I'm terrified. Terrified it will happen again. It works at first, and then it just drops. And I see the disappointment in her eyes, and I feel less of a man. 6 months avoiding intimacy. 6 months of emotional distance from the woman he loves, all because of fear, shame, and anticipatory anxiety. And that anxiety, that pressure you put on yourself, that constant fear of failing activates exactly the system that shuts down your erection. It's like pressing the accelerator and the brake at the same time. The car doesn't move, and you just get more and more frustrated. Anxiety is one of the biggest enemies of a lasting erection. When you're anxious, when you're worried and thinking, is it going to work? Will it last? Your nervous system goes into alert mode, into defense mode. And in that mode, erections simply cannot be maintained. Now, let me completely reframe how you think about this because many men have the wrong idea of what an erection actually is. An erection is not about force, squeezing, pushing, or muscle effort. An erection is flow. It's blood flow, blood coming in and staying in. It's that simple. Think of it like the plumbing in your house. Water comes in, fills the tank, and stays there thanks to pressure. But if there's a leak or the pressure drops, the water drains out and the tank empties. That's exactly what happens when you lose your erection quickly. The blood arrives, it fills, but the pressure isn't maintained. Something is letting it escape. Something is lowering the pressure you need. And forcing it, squeezing muscles, trying to hold it with pure willpower, only makes the flow worse. Because when you tense up, you constrict blood vessels, reduce circulation, and lose the erection even faster. Now let me explain what's happening inside your body after age 50. Why does this appear right at this stage of life? And why is it not a permanent sentence? There are three natural changes that occur with male aging. Three things that directly affect your ability to maintain an erection. Decreased nitric oxide. I've talked about this molecule before. It's the one that relaxes your blood vessels so blood can enter and stay. After 50, you produce less and less of it, which makes it harder to keep those vessels open, keep the pressure up, and keep the erection. Changes in functional testosterone. It's not just that total testosterone levels drop, the way your body uses and benefits from it also changes. And testosterone plays a key role in the quality and duration of erections. Loss of vascular elasticity. Your blood vessels become less flexible, less able to open fully. It's like an old garden hose that no longer stretches properly. Water can still pass through, but with less pressure and less force. But listen to me carefully. These changes are not a life sentence. They do not mean you have to accept defeat. They simply mean your body now needs more support, more care, and the right nutrients and habits. And now let's talk about the simple science. No complicated words, no confusing technical terms. Let's understand exactly what your body needs to keep a lasting erection. The real star here is nitric oxide. Not testosterone, not willpower, nitric oxide. This molecule is the chemical signal that tells your blood vessels, relax, open up, let the blood through. And once the blood is inside, nitric oxide helps keep those vessels relaxed so the blood stays put. Without enough nitric oxide, the blood enters but doesn't stay. The vessels contract too quickly, pressure drops, and you lose the erection. The problem? Many men are producing less nitric oxide without realizing it. Because of daily habits, what they eat, how they live. And they're destroying it without noticing. There are daily habits that destroy nitric oxide, that deplete it, that prevent your body from producing it properly. Smoking is the worst. Tobacco directly destroys your cell's ability to make nitric oxide. If you smoke and you want lasting erections, you have to choose. You can't have both. Excess sugar also destroys it because high blood sugar damages the lining of your vessels, and that lining is exactly where nitric oxide is produced. Chronic stress and constantly elevated cortisol block nitric oxide production too. But it's not only nitric oxide. You also need to understand how your nervous system works, because this is where many men sabotage themselves without knowing it. Your nervous system has two main modes: alarm mode, sympathetic, and pleasure mode, parasympathetic. Alarm mode is for survival, fight or flight, staying alert to danger. In this mode, your heart races, muscles tense, blood goes to your arms and legs so you can run or fight. Pleasure mode is for relaxing, digesting, reproducing, resting. In this mode, your body can get and keep erections and actually enjoy them. Here's the problem. An erection requires you to be in pleasure mode. It needs calm relaxation, not alertness. It's like trying to drive with the handbrake on. You can floor the accelerator all you want, but the car won't move properly. It's stuck. When you're anxious, overthinking, worried about whether it's working or not, you activate alarm mode, pull the handbrake, and the erection collapses. That's why some men tell me, "Doctor, I only get erections when I wake up in the morning, but when I try to be intimate with my partner, it fades fast." And I explain, when you wake up, you're relaxed, your mind isn't racing, there's no anxiety, you're in parasympathetic mode, and your body works perfectly. But when you're with your partner, you start thinking, worrying, monitoring. Is it firm? Is it going to last? That anxiety flips you into sympathetic mode and you lose it. There's another factor almost no one considers, another silent enemy sabotaging your erections. Silent inflammation and thick blood. Chronic low-grade inflammation means poorer circulation. Your vessels become irritated and stiff, less able to open fully.
That reduces flow, reduces pressure, reduces how long the erection lasts. What causes this inflammation? In our Latin diets, excess sugar, refined flours, frequent alcohol, fried foods, everything inflames. And even mild dehydration affects erection firmness directly because dehydrated blood becomes thicker, harder to move, and the pressure drops. It's like trying to pump honey instead of water. It's harder and doesn't flow as well. But here's the hopeful sign you need to hear. If you still get morning erections, even occasionally, that is an excellent sign. It means your system still works. It means the problem is not structural, it's functional and completely reversible. During sleep, your body produces more nitric oxide, there's less stress and cortisol. You're fully relaxed, and your body shows you it can still function perfectly when the conditions are right. And if you still get those morning erections, even if they're not rock hard, there is so much we can improve. Now that you understand what's happening in your body, blood flow, nitric oxide, nervous system, inflammation, let me show you what we can actually do to change this. But first, the grave mistakes. Mistakes I see every day that are stealing your staying power without you realizing it. And the first one is so common, so widespread, that almost every man does it thinking he's helping. So stay with me because what comes next could be the difference between erections that last seconds and the confidence of knowing you can last as long as you need. Let's talk about the most common mistakes that are destroying your ability to keep lasting erections. Mistakes that seem logical, that seem sensible, but that are actually making everything worse. Mistake number one, and this is huge: trying to force or squeeze to last longer. Many men tell me, "Doctor, I clench, I hold, I tense everything so it won't go down." That is exactly the opposite of what you should do. When you force, when you squeeze muscles, when you add tension, you cut off blood flow, you close the vessels, you reduce the very pressure you need to maintain the erection. It's like squeezing a garden hose while trying to fill a tank. The water can't get in properly, and the tank either doesn't fill or empties quickly. I've had patients who completely ruined their function by clenching. They developed pain and ended up with even less ability than before. One of them, Mr. Mario, 62 years old, came to me after months of tensing his whole body, abdomen, legs, even his jaw. He said, "Doctor, now I can't even get it up anymore. Before it lasted a little, now nothing." We had to undo months of the wrong habit. We had to teach him to relax, to let go, to trust his body instead of forcing it. The correction is simple but powerful. During the act, relax your jaw, relax your abdomen, breathe deeply and slowly. Release the tension instead of building it. I know it sounds contradictory. You think, if I relax, it'll go down faster. But no, tension is what makes it fall. Relaxation is what keeps the flow going. Relax your jaw especially. There is a direct connection between jaw tension and pelvic tension. When you release one, you release the other. When you release the pelvis, blood flow improves and the erection stays. Mistake number two: showing up dehydrated for intimacy. Without enough water in your body, there isn't enough blood pressure. Your blood gets thicker, harder to pump, and the erection simply cannot be maintained with the firmness you need. Your erection depends on hydraulic pressure, enough fluid in the system. If you're dehydrated, blood volume is low, pressure drops, and it collapses. Most men over 50 live chronically dehydrated. They don't drink enough water during the day and then expect their body to perform perfectly at night. Thicker blood, wussy, shorter erection. It's that direct. The fix is very simple. Drink water with lemon or a tiny pinch of baking soda 60 minutes before intimacy. Not 5 minutes before, 60 minutes. That gives your body time to absorb it. increase blood volume, and improve fluidity. Don't chug liters. That will just send you to the bathroom constantly. Drink one big glass, 300-400 ml, with the juice of half a lemon or a very small pinch of baking soda. Both lemon and baking soda help with alkalinity and naturally improve blood flow. Mistake number 3: consuming alcohol or heavy meals right before intimacy. How many times have I heard, "Doctor, we had a nice dinner, a few glasses of wine, and then tried to be together, but it didn't work"? Of course it didn't. You asked your body to do two competing things at once. Alcohol relaxes you at first and lowers inhibitions, but it also steals nitric oxide, dehydrates you, and reduces blood flow everywhere, including exactly where you need it. One glass is fine and can even help you relax. 2, 3, or 4? That almost guarantees you either won't be able to maintain it or it will be weak and short-lived. Heavy meals are just as bad. When you eat a big, fatty, carb-heavy dinner, your body sends all the blood to your stomach for digestion. If all the blood is busy digesting, there isn't enough left for an erection. Digestion and reproduction compete directly. The fix? Light dinners if intimacy is planned. Simple protein, vegetables, nothing heavy, nothing fried, nothing that needs hours to digest. And if you're going to drink, limit it to 1 glass with food. Never on an empty stomach and never right before. Now let's move on to the tricks that actually work. Natural, simple, inexpensive things you can do to improve your ability to keep longer-lasting erections. Ginger. I've talked about ginger before for circulation, but here it has a specific role. Ginger increases peripheral blood flow, including to the genitals, and contains compounds that help produce nitric oxide. How to use it: a gentle ginger infusion 1 or 2 hours before. Take a piece the size of your thumb, grate or slice it, boil in a cup of water for 5 minutes, let it steep, and drink it warm. Cloves contain eugenol, a compound that stimulates nitric oxide production. Add 2 or 3 whole cloves to your infusion or grind a tiny pinch into your morning coffee. Not every day. 3 or 4 times a week is plenty. Pumpkin seeds. These are loaded with zinc, which is essential for testosterone production, prostate health, and erection quality. A small handful every day. As a snack, mix with yogurt or unsalted on toast. Consistency is key, but none of these tricks work without a daily routine. Most men look for quick fixes. One magic remedy and done. The body doesn't work that way. Daily routine is what creates the difference. Here is my routine for lasting erections, the exact one I give my patients, the one that works. Constant hydration throughout the day. 6 to 8 glasses of water, spread from morning to afternoon, not all at once. Stop liquids 2 hours before bed. Conscious breathing, 5 minutes a day of deep breathing. Inhale through the nose for 4 seconds. Hold for 4. Exhale through the mouth for 6. Repeat for 5 minutes. This activates your parasympathetic pleasure nervous system, the exact mode you need for erections. Anti-inflammatory based diet. Reduce refined sugars and white flours. Increase vegetables and healthy fats. Avocado, olive oil, nuts. Daily movement, walk 30 minutes, gentle stretching, yoga, anything that improves circulation without stress. Consistency over intensity every single day, no excuses. I have seen patients improve dramatically in 2 to 4 weeks. Men who used to last only seconds now maintain erections for as long as they need. And now the most important part: what results to expect and when. Many men get frustrated, try something for 3 days, don't see magic, and quit. Your body needs time, weeks of proper nutrition, hydration, and habits to repair years of damage. Week 1, better rigidity. Erections feel firmer and more solid, even if they don't last much longer yet. Week 2, they start lasting a little longer, not hours, but minutes instead of seconds. Huge progress. Weeks 3 to 4, real change. Erections that last long enough for you to enjoy and feel confident. These are realistic expectations. I'm not going to lie and say you'll have 2-hour erections in 2 days. That's not real and it's not necessary. What you need is enough duration to enjoy, connect with your partner, and feel capable. And that comes in weeks, not days. One more crucial thing. Stop comparing yourself to your 30-year-old self. That comparison only hurts you. Your body is different now, and that's okay. Different doesn't mean worse, it just means it needs a little more support and attention. And with that support, it can still work perfectly, still give you satisfaction, still give you confidence. I want you to remember this, my dear. Your body can still respond at 50, 60, 70. It can still give you lasting erections, pleasure, and intimacy with your partner. I've seen 70-year-old men recover their confidence. Men who thought that part of their life was over discovered it wasn't. They just needed to understand how their body works and give it what it needs. An erection is not magic or luck. It's biology, circulation, hormones, nervous system. When you care for all of it correctly, the body responds. But remember, this is not a substitute for medical care. If you have severe erection problems, if you can't get one at all, if there's pain or other symptoms, please see a urologist. There may be issues that need professional attention. But if your problem is mainly maintaining the erection, you can get it, but it fades quickly. Then what I've shared today can truly change your life. Start tomorrow. Start with hydration, breathing, releasing tension instead of forcing, and cleaning up your diet. And if you're really going to do this, if you're going to take action and not just watch and forget, leave a comment below that says, "I'm going to try it today." I want to know you're committed, that you understood, that you're going to take care of yourself and give your body what it needs. And if this video helped you, if you learned something valuable, if you finally feel like someone is telling you the truth without trying to sell you magic pills, please subscribe to the channel. Share it with that friend you know is suffering in silence, with your brother, with your buddy. Here we share real information, advice that works, doctor to patient, with respect, with care, and with proven results. Take care of yourself, my dear. Your intimacy matters. Your confidence matters, and you deserve to feel capable and strong.